It's all about depression, about bringing out the voices of depression in youth, exposing the world to the reality of what's going on with young people and mental health issues.
With the youth population, we need to become more creative about how we get information out there in terms of prevention with mental health. I think there's been a lot more waves around using digital storytelling and photo voice and just more creative social media to get the word out there in terms of education and awareness.
The goal of Kids Data is to promote health and well-being of children in California, provide data on all counties in California. Data come from well-established public sources, so we are not a data collection site ourselves, but we liberate data. I consider myself a data democratizer or a data liberator. When we look at depression-related feelings, we find that about a third of California's 7th, 9th, and 11th graders reported that in the past 12 months, they've been so sad or hopeless that every day for at least 2 weeks that they stopped doing their normal activities.
I had no interest in things. I just spent all day or all night either crying or wondering why me, and just sitting there not doing much. But I couldn't really tell people because you're supposed to keep it in the family.
One of the phrases that's popped up a lot today is that depression is a treatable illness, and that's absolutely true. But I don't think it's curable, or at least I've never seen it be cured. My experience is not that it's curable. It's something you have that you learn how to deal with. You learn how to function in spite of that.
I'm half Filipino and half American, and so I grew up on my Filipino side once my parents divorced. The Filipino culture is beautiful. They're inviting, they're welcoming, but there is a lack of communication when it comes to sadness and depression. You don't talk about it. It was a very traditional Catholic family, and if you were sad, you didn't talk about it. You went to church and you lit a candle, or you said the rosary, and you just don't talk about it. It's a very invisible subject.
I'm going to be showing you guys a video I did about my brother. His name is Sam Charles. He's 23 years old. He's dealt with depression his entire life, and he wanted to share the story to get other young men to want to share their story.
Some people even develop a stigma for what I have. I could have developed a complete unawareness of what I'm doing, what I feel, and project it as okay. Like, men don't cry. Like, never let them see you sweat, stuff like that. Like, that develops a stigma for people like me.
But I had this internal stigma because black women are supposed to be strong. That's what we're always taught. You probably heard that term, a strong black woman. And so sometimes my family or people around me would say, kind of what I was hearing from the youth and other panel, is that you're supposed to be strong, you're weak. That's black women are supposed to be strong. Or depression is a white thing. Going to a therapist is a white thing.
Our community, in our clinic, many of the barriers come from being, in many ways, in the survival mentality. And what I mean by that is many of the families that we work with are survivors, and they're getting from one day to the next. And the priority around mental health doesn't become a priority because they're really viewing putting food on the table and looking for housing and shelter is the priority.
A simple conversation between a nurse and a mental health literacy professor thinking about what if we really gave a common language for people to feel comfortable talking about mental health and wellness and challenging their own perceptions and opinions as a way to combat stigma regarding mental health and wellness.
85% young adults and teenagers is mental health problems. This is something that surprises and shocks people. Mental health treatment to children is about a little over a third get better, about half stay the same, and about 14% get worse. In the chart where you have 2/3 get better because of the science, 1/3 get better because of our programs, filling that gap is a quality improvement challenge. There are lots of things that are going on in the research community that are extremely valuable and really are going to make a difference, and in fact are already making a difference. So there's lots of good people doing lots of good work, and I think we're really at the moment where I think we're going to see things really take off.